Every Saturday, my mom, we call her Lonnie, meets her 7 besties at Riva Cafe, just 500 meters from home in a Hamburg suburb. Lonnie is 81 and she suffers from serious health problems due to kidney failure. Her besties also have health issues. They don't like hospital rooms, waiting for medical appointments, or even sitting through conversations with doctors. But they talk about it every Saturday. They share aches and worries. They exchange advice about doctors, hospitals, and tricks that work. So this Saturday meeting proves to be a very valuable platform for them. It gives them access to the best information. 650 years of bestie experience. And because they are all in similar situations, they are great company for one another on their journey. And even more importantly, Riva allows them to make the best possible decisions on their health and well-being. So even though Riva is not perfect, it helps them to trust each other and focus on the best. Now look at my children. Ola is 20 and Svea is 19. Sorry kids for the embarrassment. Sweet, aren't they? They have a health platform too, but this time it's a digital one. Ola wakes up with a push notification, sorry. Your allergy risk is high today. Remember your medication. Svea searches for pain in the knee after running. Within seconds, she gets family history, possible courses, and everything she needs to get well again. And if needed, even a direct appointment to a sports doctor. So, and if Ola books his appointment, the doctor is already briefed by the platform. Complete history, relevant risks, and tricks and everything that he needs for treatment suggestions. Instead of repeating everything all over again, Ola can start right where he is at. And usually that is from home. So my kids, they don't scroll endless websites. They don't wait weeks for answers. This platform guides them instantly, personally, 24/7. And for them, it is as natural as WhatsApp, Spotify, or even Amazon. So, and they don't think of this being digital health. For them, it's just healthcare that works. Everything's fine for them. So, does this platform really exist? Yes and no. Yes, this is not science fiction. The technology already exists, but I made up the rest. Even the health problems of my kids. So, would you like to have a health platform like this? Would you like to have a health platform that provides instant access to all relevant information, that gives you the right supporters and friends on your journey, on your health journey, and that, of course, gives you the possibility to make the best step-by-step solutions in health? Doesn't sound bad, does it? But this platform is not a reality yet because some of us are afraid of it. And the strange thing about this is we need it so desperately. Just one example. Did you know that 30% of people in developed countries end up in the emergency room every year? And if it comes to Portugal or Spain, it's even up to 50%. This is not the zoo, this is the emergency room, and AI could help guide them to the right care sooner and take the pressure off the hospitals. It is that easy. For the past 15 years as a lawyer, I dedicated my life to ease this fear so that digital health can become a reality for everyone. I studied this fear a lot. I even wrote a book about it. It's a good book, you should read it. And it all comes down to 3 nearly unconscious beliefs, what I found out. It's physician gatekeeping. We believe that doctors always know best. That makes us hand them over the keys to our health. Second, AI anxiety. We believe that we cannot fully trust AI because it makes mistakes, and that makes us anxious. And third, data protection. We believe that if we share our data, we put it at risk, and that makes us want to hide it. These beliefs are understandable, but if we take a closer look at them, it comes to see that they're actually mistakes. Yes, doctors are the experts, but ultimately, we are in charge of our lives, as long as we are not married. But at least we are in charge of our health. And yes, AI makes mistakes, but so do healthcare professionals. And yet we trust them, so we can learn to trust AI as well. And yes, our data needs to be safe, but even the Reaver besties share all their data, and it is safe. So we can find ways to share our data and keep it safe. So this is how we can learn to trust a digital health platform, not fear it. We can learn to trust each other and focus on the best. So are there any risks to such a platform? Of course there are. But did you know that there are also many processes and practices that can ensure the right results on such a platform? I mean, I don't want to bore you with technical details, but I will. So I have a list of examples. Yeah, we do that quick. Privacy by design, human-in-the-loop audit and reversibility, patient agency, informed consent data automation, pseudonymization, role-based access control, encryption, two-factor authentication, penetration test, ethics committees, oversight boards, data localization, right to be forgotten, certification, and compliance framework. Okay, we stop here. I think you got the point. So, but seriously, what we are really talking about is simple access, guided journey, and easy decision making. So, and what we talk about is no more missing critical information, no more being left alone in healthcare, no more waiting for health appointments. And what I ask is not that you trust blindly, because this platform will operate transparently and within strong safeguards, I promise. What I ask is not that we pretend everything is perfect, running out there, everything's perfect. No, not even Reaver is. But what I ask for is that we start to trust each other and focus on the best. Because when we all trust each other, this platform can unfold its full magic. Millions of besties connected with their information, sharing their data, using AI, having their journeys, everything is on there. And then suddenly science and statistic will kick in, showing us the best of healthcare. Suddenly it's all there, we can see it. So, sharing our data on such a platform is actually an act of humanity. We need all this. And this is why I have something serious to say. So, dear doctors, healthcare providers, politicians, and everyone who is in charge of digital health and data security and regulation, hear me loud and clear. Stop putting up barriers. We need results. And to all of us, next time we hear the words digital health, let's ask ourselves what good could come from this. Let's end the power of mistaken beliefs. Let's end the pattern of this fear Let's start the conversation with trust, and finally, let's focus on the best. Every Saturday, my mom, Riva Cafe, gives my mom and her besties strength, guidance, and hope. This is not the case for my kids. So together, we can take the Riva spirit and allow this platform to become a reality for everyone. Because my kids need their platform, and so do all of us.